Hi, I'm Annie Lordi, and I'm here to interview Mr. Eric Solon about his STEM job.
hmm
Would you
All
like
right.
to introduce yourself a little bit?
Sure. Hi, I'm Eric Solon. I'm the executive director of non-clinical research at Madrigal Pharmaceuticals and been working in the business for more than 30 years anyway.
When did you first get interested in STEM?
Oh gosh, I was raised by my father, got his Ph.D. in entomology and biology and ecology, and I've always liked science, and anything to do with natural history, science, natural sciences, ever since I can remember.
So, once you knew that you wanted to be interested in science, what schooling did you do to get to where you are today?
So I started out at a community college, 2-year school, majoring in biology and with a focus also on environmental sciences, that kind of thing. Got my associates in biology and then transferred to Delaware Valley University. It was college back then, but it's university now. And still managed, majored in biology. I got out of there and then I wanted to go to work. So I was lucky enough to land a job in pharmaceutical company, Ciba-Geigy, and they paid for more schooling. So I got my master's in biology at night at Fairleigh Dickinson and then went on to get my PhD at Rutgers University. And that was in entomology, but I was still working in the pharmaceutical industry. So I had kind of a mix of molecular biology training in the entomology department, but I was working in the pharma industry. So that's kind of the background on my schooling.
You went through a little bit your path through schooling, but once you got into pharmaceutical, what was your path to your current position at Madrigal?
Oh boy, it's kind of varied. So I worked in drug safety testing at Ciba-Geigy when I first started. And so that's non-clinical research, basically testing the drugs on animal models and things like that. And then after I got my PhD, I switched out of drug safety and got into pharmacokinetic sciences, pharmacology, studying absorption, distribution, excretion, and metabolism of drugs in animal models. So from Ciba-Geigy, I jumped to Schering-Plough. I was there for a while in the pharmacokinetic and drug metabolism area and got expertise there. And then went to DuPont Pharma in Delaware and doing the same thing, pharmacokinetics. And then went to a contract research organization where I started up some labs and again studying drug distribution, absorption, ADME, what they call ADME principles of pharmacokinetics and drug metabolism. And then from there, came to Madrigal, and then I was put in charge of all of the non-clinical studies. So anything having to do with toxicology, pharmacology, pharmacokinetics, drug disposition, drug metabolism, anything that was preclinical, I had to, oversee the development of our one drug. We have one drug at Madrigal. And so anything that had to do with non-clinical research, I was put in charge of. So that's how it brought me here.
Yeah, you've had a nice long journey.
And yeah, been a long, many years.
Yeah. So my next question is, so you've had many steps in your career. Have you had a mentor during each step of your career? And was that the same person to sort of expose you to the field you are in today?
Yeah, I guess I've had a couple memorable people who have helped me. The first being my dad. He coached me through college. What courses to take, what would make me more widely marketable, because I didn't know what I wanted to do in college. I liked everything from like being a forest ranger to working in a lab, learning more and going higher in terms of a degree. And I didn't even know really what that meant when I was training, but my dad guided me so I could do a broad amount of things. And then once I got into graduated my bachelor's, and I didn't know what exactly research to do. I had good help from the vice president of research for Ciba-Geigy. I really lucked out and got to know him. And he, I was like, should I go for an MBA in pharmaceutical management or medical sciences, or go for a Ph.D.? And he said, do the Ph.D. and then you'll get management that will come along with it. And it did. In grad school and in scientific societies, I've had people along the way. When I was in grad school, I had my advisors. They were great mentors in the academic parts of it. And then when I got out, I joined some societies, and some of the old timers in the societies helped me, grow into taking leadership roles in the society. And that translated into business also. And so I had some good people that I met through societies who were great people to know, because there was no professional, he wasn't my boss or anything like that. So it was a much more mentoring kind of thing.
That's awesome. It's always great to hear that people are always there to help.
Yeah, you just got to reach out, and for me, I was always kind of a quiet or shyer guy. And, but I didn't mind getting involved in, being an officer, or even just, secretary for a society or something. Was volunteer. There's no paycheck involved, but I met so many people. They helped my career immensely,
Yeah.
But
do you have any current career aspirations?
Yeah, to retire. Yeah, Madrigal's been very, very good. It's been a lot of hard work and learning, like, all this new stuff. Like, I knew a little bit of toxicology, a little pharmacology, mostly pharmacokinetics, but I had to learn a lot more while I've been at Madrigal. So yeah, my next step is get out and go fishing and hunting and doing fun stuff for the rest of my life. I might get in back into some business, a little consulting maybe, or something totally different, but we'll see.
Why did you exactly choose this current position that you have? Why did you choose this job?
I chose this job. I was in a contract research organization, right? And it's a tough job. You have to deal with a lot of people. It's fun in that way. And you see a lot of different drugs and types of drugs. You learn a whole lot, but it was limited in where it was going. It was limited in financial opportunities as well. And so this opportunity came up at this small company, Madrigal. Again, I said we just had one drug. When I started, I think there was only 8 of us, 10 of us maybe at the most in the whole company. And so I got to really get in and learn how to develop a drug and bring it to, like, the approval stage, which is where we're at now. We're hoping to get our drug approved with the FDA now, after, starting out just doing the basic research on it and bringing it through toxicology and all the non-clinical stuff. And now our phase 3 studies in humans are showing that it works really well. And so it's been a good ride through Madrigal and learning more,
Yeah, that's awesome that you got to see it really from the very beginning and all the way through, and now you're just waiting for approval.
Mm-hmm. Mm-hmm.
It might have been a little different when you were just starting at Madrigal, but what is your current typical day at work look like?
For me now, so we've ran all these studies. I mean, probably just non-clinical studies, we run over probably 300 studies. And so right now I'm pulling all those studies together and summarizing them, basically to characterize our drug. So you want to say, okay, pharmacology, all that work. basically it boils down to just saying all these studies prove that our drug works, that it does what it's supposed to do. It goes, into the liver and controls liver fat and fibrosis and other things. And, and basically these are all the studies that show that, non-clinically. And then we want to show that it's safe. So all the toxicology studies, we've done tons of toxicology studies in multiple animal models. And so I'm summarizing that right now. So when I go into work in the day, and then also pharmacokinetic studies. So when I go into work these days, I've been writing up a summary of all these studies with some help and getting it in a format for the NDA submission, because the FDA wants everything in a certain format, and traceable and trackable, so that's kind of what I'm doing now. And I have that package pretty much put together now. So really, it's going to be kind of a waiting game after I get this all written and ready for the FDA. And then the other people in the clinical side of the company, they're getting all their clinical studies done the same way. And we put this huge package together of documents describing all this stuff. And so that's what I'm doing now. But I go in, I'm kind of lucky I can work at home, which is really great. But if I go into the office, I get in there around 8 or 9 in the morning and pretty much just work on those documents and gathering up those things, making sure the files are where they should be, and working with other people to organize the data. And then usually I'll take it easy for lunch. I go talk to people in the office, and then kind of leave the office at about 3 or 4, and come home. And then I'll turn on my computer and keep an eye on emails if I need to, respond to something, but pretty much done for the day at 3 at this point. And once we submit this thing, I don't know, or some company buys this up, then I can retire.
There you go. The end goal.
That's the end game. Yep.
Retire and go live out in the middle of the woods.
Right.
Awesome. Well, thank you so much for letting me interview you.
Mm-hmm.
It has been a pleasure.
Well, it's good I feel, good that I have an opportunity to give back, tell my story, and hopefully, help.
Yeah. Help some people along their journey as well.
Yep.
Thank you so much.